Welcome once again, and you are watching another conversation with Dr. Bakshi. Homeopathy with Dr. Bakshi. We begin with a question. Question is, many people in my town seem to be suffering increasingly from asthma. According to homeopathy, is that a serious ailment? Let's ask.
We are talking about asthma. To understand asthma, you have to understand what is the cause of asthma and how asthma has developed. You will never find the asthma come suddenly in the person. You get warning symptoms. The first warning symptom starts from the age 1. This is because of allergy. Early stages of allergy is you get repeated attacks of cough and cold. Now, allergy is always hereditary. Patient come and ask us, why I'm suffering and what should I avoid? This is a very ignorant question. I always say allergy is always hereditary. It runs in the family of the patient and it is endogenic or hereditary. Now, what is the role of exogenic allergy? There are two types of allergy, endogenic and exogenic or external. External factors are fuel on the fire, like ingestions, cosmetics, dust pollution. These are not the main cause. The main cause is the weak immune system you get it from the parents and grandparents. I have seen when a child is born within 1 month to 1 year or 2 years, if they have strong genetic inheritance, the first symptom is tendency to catch cough and cold. Or the patient will get some skin sensitivity, itching in the body, dryness in the body, redness, inflammation in the body, urticaria. These are the early symptoms of allergy, and if you are not able to treat properly this allergy, then there are different stages you have to go through, and finally comes asthma. The first is tendency to catch cough and cold very frequently. What you do is you immediately give them antihistamine, some strong palliation medicine or steroids. This suppresses the problem. You cannot suppress any problem. You have to understand suppression is the main cause of all chronic ailments. For example, this blocking the pipe. You clean it with a stick, it will get blocked again. If you do not stop garbage to come in the pipe. Similarly, you have to build up immunity so that inflammation process does not take and produces phlegm and discomfort in the bronchial tubes. What happens is, because of repeated attacks of cough and cold, histamine is released from the cell. It causes inflammation, blockage in the arteries. There's a constriction in the bronchial tubes. You will see in the normal bronchus and constricted bronchus in the slides. And what steroid does, steroid gives temporary instant relief. You take inhaler, patient will say, wow, I'm feeling much better. But that is not cure. That is temporary relief. You have to go right into the cause. That cause is to build up immunity. And you have to build up with immunity with minute, harmless, non-toxic medicines. So that on constant exposure to dust, pollution and cosmetics, you do not get allergic reactions. And when your cell is strong, no histamines are coming out of the cell, you get perfect immunity. So when you get cough and cold very frequently, this is my quote, frequent tendency to catch cough and cold, not treated properly, gets converted into tonsillitis, and finally you give stronger medicines and you get sinusitis, adenoids, and finally you get bronchial asthma. I'm not able to sleep. This is the end result of first, second, third, fourth episode. Asthma develops. So the cause is hereditary. You have to treat from the base. You have to build up medicine which has no toxic effect, which improves your immunity, and nothing to beat homeopathy. Homeopathy system of medicine is the only system I can say with confidence after treating more than 1 million patients of allergy in my clinic. I have practiced for 44th year of my practice, and we have been almost 100% successful in children. We have built up the immunity of the child, and asthma is not there.
Given the increasing prevalence of asthma in my town, are there any issues of diet that I should be aware of?
Diet plays a very important role in asthma especially. There are two types of diet. There are diets which causes constriction in the bronchial tubes. For example, starchy food. The starchy food, buttermilk. There are certain fruits like guava, which is again sticky. There are certain foods which causes constrictions called tarbooj or watermelons. When you take watermelons, musk melons, there's constriction in the tubes and the patient says, I am not able to breathe. Corn flour or maida should also be avoided. And for asthma patient, you have to eat less, especially at night, because the body is at rest. During the daytime, you're working, so you're burning your calories. When you're at rest, all the phlegm gets accumulated in the chest. And suddenly at midnight you get up. You say, I'm not able to breathe. You will find because of overeating, eating wrong food, and lastly, aerated drinks are banned. All aerated drinks, because it has a lot of preservatives, colors, should not be taken. And you should make your own list, which are things which are not good for you. Stop them for some time. But I assure you, after medication, usually in 3 months, all patients improve beautifully and inhalers are reduced or stopped. Children in 2 months, 90% inhalers are stopped. Nebulization is no more required. And when immunity is built up, then gradually you can take all these things. But during course of treatment, don't stop allopathy all of a sudden. Taper it off once you start improving. And I assure you, try this. Or you have any question, we have given you our email ID. Ask your questions, we'll respond immediately.